Okay, our next discussion topic is related to selecting a membrane for the IVRT study. And as we heard from our other speakers today, the membrane is expected to be inert with respect to drug, dosage form, receptor solution, and even the analytical method in terms of lack of interfering material with the HPLC analysis, for example. And one of the studies that is recommended to qualify the membrane is the membrane binding. The study is well described in the acyclovir cream guidance and also was covered in both Sam's and I think Sam's presentation. I think Christina also touched on it. I don't want us to spend more time on membrane binding study, but one of the other criteria that is mentioned in acyclovir cream guidance is the chemical compatibility of the membrane with the receptor solution. I would like to ask our FDA members what justification is needed to show chemical compatibility of the membrane in the application. What are you expect to see with regards to that? Maybe our colleagues from Office of Bioequivalence can chime in.
Well, I can tell you what my thought is.
Okay.
In my experience doing this, sometimes with the cellulose membrane, cellulose acetate membranes, if you've got some strong organic solvents, the membrane just clarifies, and just you can tell something's gone wrong here. So I think that from a chemical compatibility issue, what I want to be careful here is that we're not creating a mountain out of a molehill, and now you got to submit data for things and do additional studies. The thing is that the operator just needs to be aware of what's going on. When I look at my test, when I disassemble my membrane, I go, whew, then maybe that's not the best membrane for you. If you disassemble the test and the dosage form is gone, or you say, wow, my receptor volume really went down. Where did it go? Oh, it's in my dosage form. Just, I think you got to just observe what's going on. And that's why these observations, when reported in the submission throughout the method development, help the assessors to get a sense that when they're not seeing anything unusual reported, it's not because the person's not observing or not reporting, but observations are reported when they happen, but rather that all other aspects of the test appear to be under conditions where there should be no concerns that some fundamental scientific principle is being violated.
Then I might want to point out that when Christina was giving her presentation, she had mentioned that initially what we look at is the physical integrity. Do not forget the physical integrity of the membrane because we use hydroalcoholic solvents often in the industry, and some of these they curl up. And in one case, believe it or not, this we used a membrane using very strong organic solvent, and at the end of the test, we saw the membrane looked different. So membrane had completely dissolved. So all we were using was the backing of the membrane, basically. And so one needs to understand and avoid these kind of situations. So I guess, like Sam said, observations are important, during the entire method development aspect.
Correct. I agree. We sometimes, if we look for changes in coloration, things like that, and even just the texture of the membrane, sometimes it becomes more of a, elastic than it started at. Things like that, I think, are very, very important to note, apart from what the empirical data is saying.
Sam, I have a question for you. Do you think filtering drug solution through the membrane, or let's say IVRT samples through the membrane, is needed, or membrane binding study is sufficient?
I think the membrane binding study is sufficient. The individual in the chat previously clearly familiar with some of the idealized assumptions that have historically been associated with IVRT methods. But I think we have to be a little bit careful when we talk about that there's no diffusional interference or there's no resistivity or the idea that only the drug is moving and the rest of the molecules are not moving. That these are idealized theoretical constructs that serve a really good foundation for the scientific principles. In reality, the systems are more complex than that, and that's okay because we have a lot of experience and the systems work well, and we know what to ultimately look for to make sure that we can interpret the results appropriately, and that's all built into the validation. So what you're talking about, where the drug solution is filtered through, I've seen people do that in an effort to be rigorous in interpreting that there's no resistivity to the migration of drug through the membrane. I respect that. I don't think it's necessary, though. I think when you the larger concern, I think, is dealt with the membrane binding, and I think even with the membrane binding, it's good to have a membrane that is largely inert and is not actually capturing your drug as it's going through, because potentially that could interfere with things. But you're also you're seeing your release rate curves. Hopefully that it's linear. The idea that membranes play no role in influencing the rate of release is probably not true, because we see that as we change the membrane, the release rate changes. So I think it's okay to say we live in the real world. The real world is more complex than our simplified or idealized theoretical constructs. And from a practical perspective, I'm comfortable with just seeing the membrane binding data.
Okay, thank you.
Can I just add something to that? So I was just
Sure.
going back to most of the ANDAs I've looked at. Most of the time, like Sam said, we accept the membrane binding data. So most applicants also take it a step further and describe the physical nature of the membrane after the study. So that can give us an idea whether the membrane was the right one that was chosen.
Tanas, I just want to make a comment on the concentration that people use for this membrane binding studies. I know it's a pretty straightforward concept, but we see in some of the applications people were used substantially greater than the maximum sample concentration that they see at the end of their IVPT study, IVRT study. So if you use substantially higher concentration, then you might end up basically underestimating the binding capacity of that membrane and probably overestimating the inertness of the membrane. So choosing the right concentration is always important. I just want to make out that comment. Thank you.
Yeah, I agree, Abhishek, that it's difficult to interpret membrane binding data when your 100% is a very large number.
Okay. Sam, would you please advance to the next 2 bullet points? You already covered porosity in your presentation, so I think we don't need to discuss it here. What I would like to discuss is related to objective criteria for selecting some of the method parameters, and especially when it comes to membrane or receptor solution. In other words, maybe you start your IVRT method development with 3 different receptor solutions or 3 different membranes. How do you select one over the other 2 for receptor solutions? Is it just based on the solubility data or also based on the release data? And when it comes to membrane, if all of them have adequate like no binding, shows no binding of the drug to the membrane, how do you select one? And is this something that needs to be pre-specified in the protocol? So Kailas, do you want to start the discussion?
So yeah, well, scientifically, if you have an appropriate set of receiving medium, our next, if I have a good linear rate of release with one receiving medium versus the other, then what we would look at the other aspects of the safety or the discriminatory power, and make it as simple as possible. Let's say we have buffer alcohol, water alcohol, whatever, and and the data is comparable, then why go to make buffer, add one step, use water? I mean, those are the considerations that come after the initial criteria of having a linear rate and having a good sensitivity with the receiving medium. With the filter, sometimes it's a practical consideration, which brain is available. If all of them are being the same, then it's just a question of what, sometimes we just look at the availability, what's going to be available long term. I don't know if that helps anyone else has any input.
Thank you. If they have similar, I don't want to say properties, but in terms of, let's say for the receptor solution, if you can achieve sync condition with all of them, but you have different release rate when using different receptor solutions, which one you would choose?
I would choose the one with a somewhere in the middle of the range where I have a good dose depletion and not very high dose depletion. Then I would like to stay in the middle range rather. So because then you're also going to use 150%, remember. So then you have, higher dose depletion there. So I would prefer to stay in the middle range and look at then you, well, no, I take it back. Then I look at the variability, the precision of the method, which if you everything else being the same, then which solvent system or which system gives me the best precision, best technique gives me best precision, and go with that.
Okay, thank you. Anyone else wants to chime in?
Can I add a comment there? So I agree with what Kailash mentioned, that it really depends. And what we are talking here is about method development. And in my opinion, I mean, it's very difficult. I mean, we are in the process of developing a method, and going with the pre-specified criteria is too. I think, in my opinion, is too much, because it really, I mean, I think it's up to the applicant or CRO how they want to develop the method. And I think Sam earlier showed very nice data that sometimes we see that you go for a steep release rate, but by using that one, you might compromise the variability there, or you see slightly curve on your data. So it really depends. As long as it meets the validation, it should be fine. But for the development, I think something like 3 as a starting point, 3 receptor solution, 3 membrane, and if you try to figure it out which one works best. And you have to also consider that you're going to go for the 150% dose depletion. So it's not just one thing. You have to consider multiple parameters to figure it out, which receptor solution and which membrane you want to pick and move forward for the validation.
Yep.
Okay, thank you. Can we move to the next topic, which is related to membrane equilibration? So the membrane temperature at the when it's placed on a diffusion cell needs to be equilibrated and stabilized at 32 degrees Celsius if you're using the IVRT for a topical dermatological drug product, and that needs to be done prior to the dosing. The question is, what is the typical duration that is expected to assure the membrane is sufficiently equilibrated? Maybe Theo or Kailash or Christina can chime in based on their experience.
Christina, you have some.
Yeah, typically our equilibration time is long enough for the received media and the membrane to come to appropriate temperature, and for it to be in contact with the receptor solution. We don't have a specific like 30 minutes of equilibration or anything like that. It's really just until the temperature is correct and you can see that the membrane has been wetted.
Yeah, normally how we do, here we apply to the cell, we are putting all 6 membranes to the receptor medium at same temperature, 32 and half an hour. And after that, we do visual evaluation if any colors changing and some shrinking and any depletion happens. If not, we are putting on the cells and drying on and a little bit watching if back diffusion is coming and everything's okay. maybe 10 minutes, and after that we start the dosing.
Okay, thank you.
Can I add to that? I know the USP chapter said something about greater than 30 minutes. So as a reviewer, we kind of look at that. So anything after 30 minutes, I guess, is fine. But when it's less than 30 minutes, I guess we have to kind of just ask the applicants to provide some justification why it was less than that.
Okay, thank you. I have a related question, and that is for membrane wetting. So it's a common practice to soak the membrane in the, let's say, receptor solution prior to its use. But is it needed? Can the IVRT study be done without membrane wetting?
No, I have had the practice of never to really need to do that, because when you are equilibrating the membrane on the donor chamber, on the receiving chamber, it's already wet. So the equilibrium establishes between a wet membrane and the receiving medium. And by the time you use it, it is wet, and it is wet for at least 30 minutes by the time the membrane attains the 32 degrees centigrade. It's at least about 30 minutes. So it's already soaked. In my opinion, if you have a step that you should soak for 30 minutes, then you have to worry. It's a variable. That's why I add an extra variable. So then it is 30 minutes, 31 minutes, 29 minutes. And I have never had any instance where it has made any difference in the release rate. So I do not necessarily practice that.
Thank you for clarifying. And I think the last discussion point related to membrane is membrane reproducibility and quality control. Kayla's already discussed that a little bit in her presentation, and the differences that might be between different manufacturer of the membrane and availability of the membrane is something that needs to be considered. You want to select a membrane that is commonly used, and it hopefully is available in a few years that you may. So for now, you may use the IVRT for bioequivalence purposes, but maybe down the line in the next few years, you may use it for SUPAC changes. So you want to use something that should be available in the future as well.